Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amie.
And my name is Sarah.
And we are your podcast hosts. So we just wanted to let you all know that our Gritty Nurse apparel line is dropping on Friday. So get your calendars out, mark it down, get ready. The date is October 16th, 2020. So please go to www.grittynurse.com. Our apparel line is primarily about making a statement. We want nurses to feel that their voices will be heard. So please join us in this movement, join the conversation, and make a statement by wearing the Gritty Nurse apparel.
And we also just wanted to let you know, if you're listening on Apple Podcasts, Google, Spotify, Amazon, or any other podcast platform, just be sure to hit subscribe so you can get a notification every time we have a new episode. Also, don't forget to rate and review us. And we also want to let all of our listeners know that we have a Patreon account. You can find us on patreon.com/grittynurse. And also, we're really excited we finally got our first Patreon. So thank you so much, Charlie, for being our first Patreon and pledging a monthly donation to us. All of the donations that we receive are going towards monthly costs of hosting the podcast, buying audio equipment, the time it takes us to research our website. So it's all going to a great cause, and it's really just going to help us continue to bring quality podcast material to you. So we're going to talk about a topic that is near and dear to our hearts this month. It's actually perinatal loss, and in honor of Perinatal Loss Awareness Month, we wanted to talk about some of our personal experiences with loss, as well as our clinical experience, things that we've experienced on the job. Amie and I, as you know, are former obstetrical nurses, and as well, I worked in a women's clinic where we had an early pregnancy loss sessions. And so I'm going to let Amie introduce a guest that we have today. She's a very special guest, and Amie, I'll let you take it away.
Thanks, Sarah. So today we do have a guest. She's near and dear to my heart as well because she's my sister-in-law. We've had lots of laughs together as well as little squabbles, but it's all fun and love and within the family. So Jessica, she's a practicing licensed professional counselor for the state of Ohio. She's earned her Master's of Arts degree in clinical mental health counseling from Bowling Green State University. And her special areas of interest include women issues, codependency, and those who struggle with attachment issues. So welcome, Jessica, to the Gritty Nurse Podcast.
Hi, Sarah. Hi, Amie. Thanks so much for having me on.
We're so happy to have you. I mean, you should be kind of a pro at this because your husband, my brother, does a lot of film stuff. And I used to watch, I probably still actually watch, I haven't seen any recently, that you guys would do like your like munchies with Jordan and, with Jordan, you know what I'm trying to say, with Lenny and Jess. And I'm like, I haven't seen those updates in a while. They were so funny and cute.
Yeah. We stopped them. We got kind of just everything going on in the world right now. We kind of just stopped them because we didn't find them to be as appropriate for the times.
Right. No, I hear you.
Yeah.
But the other thing I want to kind of throw out there, and this is absolutely random, Jessica probably bakes some of the most beautiful cupcakes, cookies, desserts I've ever seen and eaten.
Thank you.
Every time I see something on your page, I'm like, why are you stuck in America? It's so frustrating. And you know what? I have to be honest. I think my favorite are the Buckeye balls. So I know I'm like totally diverging, but Buckeye balls are essentially, it's like a Reese's Pieces ball.
Oh, I love Reese's Pieces.
But 10 times better.
Oh, no way.
So I'm very sad that you are stuck in America. Well, I shouldn't say stuck in America, but because of COVID and whatnot. But thanks for coming. And yeah, we'll kind of get into talking about perinatal loss. So I guess I might just jump in first. And this is very timely because, at least for me, it is too, because it's also mental health awareness, I guess, month as well as perinatal loss month. And I think for me, when I think about perinatal loss and just mental health, I feel like the two really do go hand in hand. So I'll probably get around to it today at some point, but like talking about my two loss experiences. And it's kind of funny that actually only yesterday that I mentioned to Jessica that I had more than one loss, that I've actually had two, because I actually didn't tell anybody that I actually had a pregnancy this year, which I ended up having a miscarriage. So that was very something that was very, I don't know why. I just, for whatever reason, kept this one very silent and very close to me, my own chest. But I think we can kind of talk and maybe even unpack that. And Jessica, because you have your psychology background, you might even
Yeah,
be able to kind of explain why women, and maybe not all, I think some, we all react to loss very differently, but
right.
just kind of why and how we go about doing the things that we do. But because you're our guest, and if you don't mind, maybe we can start with a story first. So, Jessica, would you be comfortable sharing your story with us?
Sure. So I have actually had two losses as well. My first loss was in 2005, right after actually we got married. Um, and I was 12 weeks at the time of that loss. And so I say thankfully, my doctor let me do a DNC for that one. It was like an emergency situation because at the time that they figured it out, they said that the baby had been dead for quite some time. And I remember it was a Thursday when I found out. And the doctor was like, if we don't schedule emergency, procedure for you tomorrow, like there's no way you'll be toxic by Monday. Like we can't
Oh my
wait for the
gosh.
weekend because it had been that long. So I remember sitting in the doctor's office till like past 6 o'clock in the evening on Thursday night so they
Oh
could
no.
schedule me, yeah, for a procedure on Friday morning, like at 7 in the morning, I think it was, where I had to go back and get the DNC. So that was my first experience with loss. That was it was traumatic, but it wasn't um, as traumatic as my second loss, I guess. The first time around, obviously, they put you under for the DNC. And when I woke up, I just remember um, being very irritable. And I actually called the nurse a bitch.
Oh man.
I don't know why. But
Oh.
I remember like my sister was there with me and she was like, Jessica, get a hold of yourself. Like, and I was like, tell that fucking bitch like to get out of my face. Like I was
Oh.
pissed. But the doctor must have come in and talked to my husband, Lenny, and said, she was very emotional like during the procedure, which I
Right.
have no recollection of, but apparently I was crying like during the procedure.
Oh.
Yeah, it's like the craziest thing I've ever heard in my life. So it was traumatic to me in a sense, I guess. And it was obviously sad. But I think it was not as traumatic because we weren't even trying at that time. It was kind of more like a surprise
Right, right.
pregnancy. And so I guess it didn't sting as much, if that makes sense.
No, like I understand that. And I think that, like, especially like it's almost that it's like, and I think everyone's experience is different, but like, the turnaround time was really quick. Um, maybe, again, because maybe you weren't trying, it's just like, oh, this was a surprise, and then it was like, okay, well, this really sucks and whatever. And I think just everybody deals with it very differently. And I think as a healthcare professional, maybe Sarah, you can kind of speak to this too with your early pregnancy clinic loss. I think every organization does it a little bit differently. So,
Yeah, I think it's really interesting because I think everyone, like you said, deals with it differently. Some people would try to rationalize it by saying, "Oh, like in nature, all animals experience miscarriage. It's just not meant to be." Other people were really emotional. I found that a lot of people often blame themselves. So they would find something really small that they had done, like, oh, maybe I shouldn't have worked out. Maybe I shouldn't have lifted that
Mhm.
heavy box. Like it was just a lot of self blame. So my role, even though I was a clinic nurse, I felt like a majority of my role was just providing that emotional support to women ongoing because they really needed it. And I think also in our culture, we don't talk about pregnancy until it's 12 weeks. So a lot of these women
Mhm.
had no one to tell and they felt very alone in how they could cope with this loss. So I think that's also something that our society needs, is maybe just a little bit more support for women in that early stage if they need it.
Oh, I wholeheartedly agree. Like, I mean, and Jessica, jump in at any point in time. Like, I think that ED experience is so crucial because I've heard so many horror stories about people like coming to the ED. Maybe they're actively, bleeding or whatever the case may be, and their experiences are the worst.
Yeah.
And I mean, I think even the fact that you had to wait that long of a period to kind of get the process started. You're sitting there knowing that this is happening to you. It's happening in your body, and you have no power over it. You have no control over it, and it's just kind of, and that sitting and agonizing, at least for me during my experience, was probably one of the worst. And then I was in a ED situation where they had like a lost clinic, but it was conveniently placed close to their other early pregnancy clinic where people with pregnancies were coming and passing. So it was
Yeah.
just like, okay, I'm here, I'm losing my baby,
Right.
and I have these pregnant women passing me. Like, it was somewhat of a nightmare.
Absolutely. I think another piece to maybe why that first loss wasn't as like traumatic to me was that my entire family, we have a history of miscarriage.
Right.
And even though the doctor says it's not hereditary, like I don't even believe it really, because there has been so many cases of my sisters and my mother, like at least everyone's had two miscarriages, if not more,
Wow.
in my family. So skipping ahead, I guess, a little bit, we maybe did find a piece to that puzzle. Like, so maybe, miscarriage isn't hereditary, but apparently we found out after my second loss that I carry a gene for something called MTHFR. Um, and so I don't have this gene, but I carry it, which means one of my parents carries it also, which is basically something that can cause you to have like blood clotting issues.
Right.
And so, if my sisters or my mother have that as well, that could be a component to why we were so susceptible to miscarriage.
Interesting.
Yeah, definitely. They found that out after my second loss when they were doing more extensive testing.
Do you mind telling us a little bit about your second loss?
Yeah, so the second loss was in 2008, so it was 3 years later. We were actively trying for a pregnancy. We had been trying for quite some time. I had been on fertility drugs. That didn't work. I ended up going to one of those, I call her like a witch doctor, like one of those people that like read your muscle testing and do like the vitamin testing and stuff like that on you.
Okay, so like
And
a homeopathic.
yeah, like she, I call her the witch
I
lady
love
because
how
like
we just use the term witch doctor.
yeah, I totally do. Like I would say it to her face, like I think you're a witch. But she got me on this like Chinese herbal medicine that within taking it and following her regimen within 28 days I became pregnant
Whoa.
with my second pregnancy. So everything was going good for maybe 6 weeks or so, and then I started bleeding really heavy. um, I was sure, like I was positive I had miscarried again because I had gone through the experience once before.
Right.
But the doctor, I hadn't been in for my first ultrasound yet because I was still like at 5 or 6 weeks, I think. And the doctor was like, well, we still want you to come in. We need to check, make sure like everything's passed, yada, yada, yada. So I remember going in to get my ultrasound, just like you said, Amie, sitting in a room full of pregnant women, waiting for the shoe to drop, And the nurse took me back for my ultrasound to check everything. And she was like, well, I don't know what you're talking about, but there's your baby's heartbeat.
Right.
And I was just like, I didn't believe her because I had been bleeding like so much for probably a week or so.
Right, right.
And then, of course, they try to normalize it and say, well, spotting's normal and yada. And I'm like, this isn't spotting, this was like buckets of blood, but not to be gross or anything. But
Hey, we're
so
nurses.
they
It's
were like,
okay.
yeah, they were like, well, we don't really know what that was, but your baby's fine. Everything seems fine. Um, I still was very nervous, obviously, because of my past and like my family's past history with child loss. So I still was, like a nervous wreck the whole time. I started to get a little bit more comfortable as time went on, and I was having like additional ultrasounds and everything was going okay. We waited until 13 weeks to tell everyone because just, past and everything.
Right. Yeah.
So we announced at like 13 weeks to everybody that we were going to have a baby. And everything was still going, okay. But I guess they always say like mom knows.
Yeah.
Um, I just was always a wreck. Like I always knew, like I just felt like something was going to be wrong. Um, Sorry.
No, it's okay.
So everything seemed to be going fine, and Lenny was like doting on me. He would not let me do anything. It was like you just rest, and like I was doing everything right. Like everything they tell you to do, I was doing it.
Right.
Um, we went
Mm-hmm.
to Canada actually, um, like the week before or the weekend before. I think we went up and there was a barbecue and at your Uncle Junior's, Amie.
Okay. Yeah.
And I was fine. Everything was fine. I felt fine. Um, we got back home on Sunday and I woke up for work on Monday morning and just blood was running down my leg. Like,
Yeah.
um, and I'm like, what the hell? So obviously, of course, it's like, 6:30 in the morning. And so your doctor's not awake. So, or not in yet. So, I had to go through the emergency, which at that time, the hospital was like 45 minutes from my house. So we got there and they brought me in really quick and put me by the nurse's station. And that was when I lost my modesty because literally I had like no less than 7 or 8 people like in there looking at me. Um,
Right.
and I was just, and the door was wide open and, it was right by the nurse's station. So like everybody's walking by.
Yeah,
Yeah.
yeah.
And they're like, we're going to take you back, for like an emergency ultrasound and everything's fine. Like, don't worry, yada yada. Well, they wouldn't let Lenny go with me back to the
Right.
ultrasound,
Why?
and
That's so
because
crazy.
they're assholes. So,
Oh, okay.
um, of course, they take me in there, and like, there's no heartbeat,
Right.
and I'm
Mm.
saying to the girl, "What's the matter?" And she's like, "Oh, ma'am, I can't tell you," and I'm like, "You need to tell me what's the matter." Like,
Yeah. But at
obviously, I
that
know
point,
something's wrong.
right? Yeah.
And I'm like, I need my husband. Like, please let him come back here. Well, they wouldn't let him come back. And then, like, of course, they didn't know at that time exactly what was wrong, but they just knew like something had happened to the baby. And I was 18 weeks and 3 days. So the ER doctor had to come back and tell me, like, your doctor's going to be here later, but he wants me to take you up to labor and delivery because, like, you have to deliver this baby.
Right.
And I'm like, no, no, I don't have to. Like, just give me a DNC. Like, I don't want to know anything. I don't want to see anything. I don't want to know anything.
Yeah.
And they were just like, no, we're sorry. Like, your baby's too big for that.
Oh man, I can't imagine what you must have been going through.
Ugh, it was the worst day of my life, like, by far. Um, so they took me up to labor and delivery. So, Amie, again, I know exactly what you mean because I had to pass my baby with everybody having babies,
Yeah.
like the
And no
same floor.
support? And you didn't have any support?
I mean, Lenny,
Did he
um,
they let him come up
they
afterwards?
let him. They let him. Yeah, they just didn't let him go back for the ultrasound.
Okay.
Um, so I remember them having to like insert a pill or like some type of medication that would make me go into labor.
Yeah,
Yeah.
it's called misoprostol. Yeah.
And it's the one where like nobody can touch it, right?
Yeah.
Yeah.
So they
They
were
wear
like,
gloves and
yeah, they
even
were
double
like
glove or whatever.
freaking
Yeah.
out, and they were like, nobody that's pregnant can touch this, absolutely nobody. And
Well, that's lovely that they were saying that
uh,
in front of
he,
you,
yeah,
like, you
and like
know.
we need to put, and then they were like, so it could happen within like a few minutes or like a few days, like a couple
Oh
days.
my god.
And I'm like,
Well,
what?
that's not very reassuring.
Like they had no time frame for me, because they said it's different for every person, like how quickly your body will like react to it.
Right, yeah.
Um, so at that point, I don't even remember. Like, obviously, I got to the hospital like 7 in the morning. Um, I think I dozed on and off, like just in horror all day long. Um, and it was maybe 10 o'clock at night when because the nurse said, if you feel something, like tell me, like don't push, we'll call the doctor.
Right.
So I think it was like 10 o'clock. I just felt like no pain. It didn't hurt or anything, but it just felt like I was going to have like, pass a big blood clot, or like needed to like kind of push something, if that makes any sense.
Yeah, no.
Um, so I immediately told Lenny, like, something's going on, like something's happening.
Right.
And so he rang for the nurse, and finally the doctor came, and I just remember, like, earlier in the day, I remember telling them I didn't want to know what I was having. I didn't want to see it. Like, I just was so, I don't know how to explain it to you. Like, I was just dissociating. Like, I was just like, I can't handle this.
Yeah.
Um, so anyhow, that news wasn't relayed to my doctor somehow. And so after delivery, um, I saw them push the little cart, off to the side of the room, and I saw the
Oh
doctor
my
go over
god,
there and
no.
like look at him, and um, I just remember like screaming the whole time, like I'm just bawling and screaming like the entire time. The doctor came over and said, "You had a little boy."
Oh. I'm so sorry
And
this
I'm just
happened to
like,
you.
I was like, just out of my mind, just like out of my mind. And I I don't even remember like what happened. He said something like he was sorry,
Right.
and I just remember that nurse, like, I don't know who she was. I don't remember her name,
It's okay,
but
Jess.
she pushed something into my IV, and I literally just passed out. And I was so thankful to her because I didn't want to be there.
I understand, yeah.
And I woke up, I don't know how long, like hours later, and uh, she helped me go to the bathroom, and she gave me some stuff to kind of like wipe off, or, you know, kind of clean, because they just literally like let me pass out and like
She just helped clean you up a
collapse.
bit.
Yeah. Um, and then I was just like, please, please, like more drugs. Like, I just did not even want to be.
Yeah.
And I remember thinking I felt so bad because in those hours, like Lenny was by himself, and I don't know, how he was feeling or doing, or because it was literally like they knocked me out, like for surgery or something. Like I
Yeah.
was just out, like completely out. Um, so that was that. Another like painful part for me was at that hospital where the babies like are delivered. They play like music when a baby is born, And so I had to keep hearing, like every time somebody would have a baby, um, I had to keep hearing
That music.
the music going off.
I don't
And
even think they would even recognize that that would be something that would affect women who are going through a loss. Like I think, excuse me.
yeah,
I
sorry
think
guys.
it's no, it's okay. I think that would be such an important message to let organizations know, right? Like our organization doesn't do that, but like the fact of the matter is like there are other people who aren't experiencing something that's joyous or happy, and for
Yeah,
them to hear that music playing would be heartbreaking.
it was just like, a reminder of like, great, I'm a failure. And, you know,
Yeah.
great. Like, so, anyways, I got to go home the next day. And I mean, I really healed fine and, like nothing like that. I do remember they had to tag me for a blood transfusion,
Holy crow.
just in case I needed it
Okay.
because I had lost a lot of blood. And then the doctor, between the time I came in the morning and left the next day, had taken 17 vials of blood,
Whoa.
um,
Wow. Oh
because
my
they
gosh.
wanted to check so many things because I had a second trimester miscarriage.
Right.
So of course they didn't take all those out like once, but it was between like that 7 a.m. and like 10 or 11 the next day. Like they took that many from me to do all these tests.
Wow.
Yeah.
And then like I guess before I kind of talk about my own experience, what what was the aftermath like for you? So this is 2008, fast forward to
Yeah.
2020.
Yeah. So we ended up finding out that the baby had something called gastroschisis,
Right.
which is where your basically your intestines and it can be other like abdominal organs are actually outside of the body.
Right.
So the
Right.
doctor could see that when I delivered, and he said it was like very severe, which is obviously probably why the baby just could not survive. At that time, I think it was like 1 in 12,000. They said had that, but now it's. I was looking it up today. It's more common in today's world.
Right.
So it's
Right.
like
Mhm.
maybe 1 in every 2 or 3,000 births.
Oh
Oh,
wow.
wow, that's
Um,
changed a lot.
yeah,
Makes you
um,
kind of wonder, right?
yeah. So aftermath was basically I just could not
Yeah.
um, go through trying and failing again. Not failing, but you know what I mean.
Yeah,
Trying
yeah.
and not being successful. Um, I guess there's days when I regret that choice, but there's more days than not that I don't regret it because it for me was so traumatic. I would not wish that day on my worst enemy in
Right.
life.
Yeah.
Like I literally wouldn't.
Mhm.
And even if that was my worst enemy, like I would be in that hospital with her, like holding her hand, because that was it's just undescribable if you've never been through something like that.
Well, I think this is
Yeah,
a
for
really
sure.
powerful story. For you to find out about the gastroschisis, was that helpful or not helpful in just sort of coping with everything that happened?
I think it was helpful because the doctor was like, "It's nothing you did. It was nothing Lenny did. It was nothing genetic. Like yada yada yada." But it didn't help me any. You know, they did find out that gene I told you about, that MTHFR. So the doctor
Right.
said, like, next time if you want to get pregnant, like 3 months before you get pregnant, we'll start you like on a low dose aspirin regimen, because you could become symptomatic during pregnancy, and that could be why you've had like the first miscarriage and all that. And he did say, my risk of increase was a little bit higher than most people because of having the second trimester loss.
Right.
He said we would do like more ultrasounds than normal and all that kind of stuff. But it just wasn't enough for me. Like I was just like, yeah, good luck with that. Like I'm, I'm never going through this again.
Right. And I think
Mm-hmm.
that's fair, right? Like I think everyone's experience has to be individualized to the person, right? Like I think there's no right or wrong way to deal with a loss. Like I think one of the things that healthcare providers say is a loss is a loss is a loss, and it's
Mhm.
completely dependent on how that person perceives it, right? Some people may have a 12-week loss, and to them they're like, oh, that's it. It's fine. No big
Mhm.
deal. And someone might have a 6-week loss, and that is the most devastating event that they've ever had. And I think you just have to understand that people perceive things differently, and we can't judge people based on the time of loss versus, whether this person was earlier or later. It's really based on how the person experiences that loss. And I think from from my perspective, being on both ends, so while I was actually actively working as a labor and delivery nurse, I didn't have any children. So I think for me it was kind of like, helping patients through a loss I found actually quite rewarding. Not that I was asking specifically. I know it sounds kind of weird, but I never like asked for these patients, because obviously you never know what happens. If someone comes in, let's say it's decreased fetal movement, or they're bleeding, or they might just be coming in for a routine check. We don't know, they don't know. And sometimes, for us as healthcare providers, we kind of we know right away, right? We put the ultrasound and the transducer on, so those are the two things. So one's to pick up contractions, and the other one's to pick up fetal heart rate. And you can tell, like, I mean in my first go at it, and I think Sarah can probably relate to this. It's probably for us, it's kind of like, oh no situation. And I think most.
And you're trying not to let it show on your face, like you alluded to, Jessica. When someone's sort of just silent, it's because we don't we don't want to say anything, right? We're just kind of hoping that the heartbeat was just hard to pick
Right.
up or whatever. Like it's just we're trying to not we're just trying to put on a poker face until we know for sure what's
And I'll be
happening.
honest, our poker faces are shit, because if we're taking 5 minutes to find the fetal heart rate, and you've come in before, and oh, there's a baby, it's fine.
Yeah.
um our tell signs are pretty significant. And I think, like, I mean, there's you just know, you get that pit in your feeling. And when people can find the heart rate, they tell you right away. They'll be like, hey, there's a heart rate, everything's
Yeah.
okay, let's move on to the next thing. But it's that silence where they give you nothing, right? And I remember as a healthcare provider being like, okay, I'm not going to give platitudes, I'm not going to lie, but I have to be very cautious as what I say, because like I can't confirm. It's like that whole, I can't confirm nor deny, right? but
Yeah.
but they
Like
know.
here, they're not even allowed to say anything. Like they're not technically supposed to say anything. So I knew that girl was doing her job. I have enough medical professionals in my family to know that.
Yeah.
But
Well,
when
like,
you're in that position, that situation, you're like, no, speak now.
yeah, and I think
Right, right.
that's another thing to take back, right? Like, I mean, I remember being in a situation where this lovely couple came in. I think she was around like 34, 35 weeks. And I think she was just coming in with, I think it was actually decreased fetal movement. And I remember I got her ready, set her up on the monitor, and I'm like looking, right? Like, so I have the gel, and I'm like rubbing it on her tummy, and I'm like, where did you find the heart rate last time? And she's showing me. So I'm like, okay, I'm moving it around. And then I'm like, oh, let me try here. And now I'm like, her stomach is like full of jelly, and she just kind of has this look. And I'm like, it's just sometimes it takes a little bit longer. And then I definitely couldn't find it. So I was like, okay, I'm just going to ask another nurse, like, because I still felt relatively novice. So I was like, okay, I'm going to just ask another nurse. So another nurse came in. And I think at that point she knew that some, like, shit was hitting the fan.
Yeah.
And the other nurse just kind of had this look on her face and was like, okay, so at this point, I think we just need to get the doctor to do an ultrasound. And she let out this blood curdling scream. And
Yeah.
I'll never forget it to this day. Like, she screamed so loud, and her husband he just dropped to the floor. And it was the most heartbreaking thing I ever saw.
Yeah.
And I just remember being like, shit, like I don't have capacity. I have no idea. Like, from a healthcare provider, like, they tell you go to all these courses and you do training, but
Mm.
no one can prepare you for that raw emotion. No one can.
Yeah.
There's And I think in that moment I didn't say anything. I just held her.
Mm.
Like, I just held her hand, and he was down on the
Mm-hmm.
ground crying, and she just leaned over herself because she was quite big as well, because she was like 34 plus weeks.
Yeah.
And there are no words. Like, I don't I and I think, even just from my own experience, I don't want platitudes. I don't think I wanted someone to be like, it's a part of God's plan or any of that bullshit, because I
No,
think
I
someone
think you
might get
did.
stabbed in the eye
Yeah.
if they said
Yeah.
that to me, right? Like, I think, like, I didn't want any of that.
Amy, I think you did exactly what she needed in that moment. I don't think she needed anything else except for you to just be there and hold her hand. Like, you didn't need to say it's okay, or,
Yeah, but
like,
some
I don't
people
think
do
that
that, right? Like,
any of
some
that would have
people, like, I've
helped.
seen people
Yeah.
and they're like, "Oh, it's okay," or what are some of the other things? "Oh, you can have more later," or, like, I don't
Like
know why people think that these things are okay
Or
to
they say
say. It's
something
like, no,
like
that's fucked up.
Or they
Don't
say
say
something like,
that.
at least you were only like this far along,
exactly.
but you and I have had training. Remember, Amy, we've had training. So, in the training that we had, they go through a list of things literally not
Yeah.
to say. And all of those are on that list. So I think that if people can take anything away from this, especially other nurses that haven't worked with perinatal loss, it would be very beneficial to take some sort of course or training to understand how to work with patients that have experienced or are experiencing a loss. It's really impactful. And even Jessica, as you were saying, you still remember back from 2005 that nurse that put you out, right? Like, she did what you needed in that moment. And it's so
Mhm.
important that we just, recognize this and develop the skills to be able to give the best care that we can.
And I think it's just like, it's not even just us too, because I remember after that, when the doctor came in, the bedside manner of the physician was horrible. Like, I was trying to think of a nice way to put it, but it was really horrible, because the physician walked in, put the ultrasound on, and was like, "Your baby's dead. I'm sorry," and left. That was it. Because it was just like, and this is the worst. And maybe someone's gonna shit on me for saying this. Let me tell you, there are some great physicians out there that will take the time and will sit with you and will cry with you and be in the moment with you. But there are some that are just so fucking cruel, and it's almost like it's not worth their time anymore, because, yeah, I, healthcare is a business. Having a baby is a business. They don't make a lot of money off of perinatal loss. It's just kind of like, I remember doctors being like, just call me when she's delivering. Like, they want nothing to do with it. And that could maybe just be because they're not comfortable with it themselves, or whatever the case may be. But patients can feel that. They can tell that you're not invested and that you don't care. And the other thing that I noticed, and I don't know if
Hmm.
this was the same with you, Jessica, for whatever reason, when it comes to loss, it's not one-to-one nursing care anymore. So what tends to happen is, um, let's say a patient comes in and they're experiencing a loss, you'll still have a laboring patient plus this patient who needs much more. So their physical needs aren't as much, but their psychological needs
Yeah.
are great. And it's emotionally draining for the nurse and for the patient, because all of a sudden, you've said to them, "Hey, if you need anything, call me. I'll be back in 5 minutes." And I think the worst part is not being able to kind of come back to your patient, because now you have another assignment as well. And I think
Yeah.
that's like the worst case scenario, where that this person needs you emotionally, and you can't be there because of how the system has set itself up.
And if you think even about from the nurse's perspective, like, she has to switch her emotions on and off. She's in a room delivering a baby, right? It's a really happy time for everyone. They're celebrating. And then you've got to leave that room and go back to your other patient who is having a loss. And you have to, hold their hand and make sure that you're there with them. It's really hard as well, right? Because you're trying to be happy with one patient and you're trying to grieve with the other patient. It's not an easy thing to
It's
do
super duper messed
by
up.
any means.
But thank you, Jessica. That was actually, and this is so, Jessica, how many years have we known each other for?
Um, since 2003.
Right. And this is the first time I'm actually hearing your story. So, I
Yeah,
mean, I think that speaks volumes too, right? Like, I feel like,
because I don't talk. I don't. I've never told that story. Like, um, not that in depth to anybody, maybe.
Yeah, like, and I think these stories are so important. I think it's so important for other women. Oh my god, I'm starting to like getting all tight in the chest. I think it's so important for other women to share these experiences. I think we're, for whatever reason, we take it upon ourselves as maybe people don't care, or um they don't want to hear stories about
Yeah.
my loss or my experience, or even my own feeling, the fear of that, I'm less of a person because I can't do, like, yes, I do have children, but that, like, somehow my body failed itself, and it's like, it's almost kind of like like feeling ashamed. It's kind of really weird, and that's, I guess, what would bring me to my second loss. I'll talk about my first because it's, again, it wasn't as traumatic, but like, I think the reason I didn't really talk about the second loss is because, I don't know, you feel, it's really bizarre, but you feel shame.
Mhm.
And it was a weird emotion that kind of, for me, surprised me, because I was kind of like, why am I feeling ashamed? And I think it was just, so this was, I guess, oh my gosh, this would have been in March of this year. And Jordan and I were talking and playing with the idea of having a fourth child, which is crazy in itself. But we were kind of like, hey, we'll see if anything happens. Because I also have polycystic ovarian syndrome. So I don't ovulate regularly, or I create too many cysts that actually don't have an egg. So that's what, and hence having twins, because we had to use fertility. So with this particular situation, um, it was actually a crazy kind of story. So I hadn't had my period in something like 2.5, 3 months. And I was kind of like, oh, this is normal for me. Cause like, I get periods maybe like 4 times a year, but usually they're like deathly heavy where I have to take time off of work. But I was just like, oh, I was
Right, I
like, oh,
remember that.
a day in the life, whatever. And I was like, I'm going to scare the shit out of Jordan by getting a pregnancy test and then actually coloring in the purple line and being like,
Oh,
hey,
Amie. So bad.
I
I
can
know,
so
right?
see
Because
you doing
like
that.
my practical jokes are the worst, right? So I was like, I'm gonna like fuck with him today, and I'm gonna like color in this line. So I just went to the dollar store. I wasn't, because like I wasn't planning on like getting like a proper pregnancy test. So I went to Dollarama. They got these Dollarama tests. You can get like as many as you want. So I was like, I'll just pick one or two of them up. And so I went to the bathroom, and I could hear him coming in, and I was like, oh man, I don't want him to hear me like stirring in the bathroom. So I'm like, I gotta do this quick. So I peed, dropped the pee onto the stick, and like bolted out of the bathroom. So like I was helping him get the groceries in and whatever. And I was like, okay, I better go back and like, do this like messing with him, right? So I have the like pink marker in my hand, and I go into the bathroom. I'm like, I look at the test, I'm like, what the? I'm like, oh shit. I'm like, hold on. There's two lines here. I'm like,
And you're like double checking the
I'm like,
package,
I'm
right? To
like,
make sure
I'm
that
like,
this
is
is
this like faulty? And I still have the marker in my hand. And Jordan comes into the bathroom, and he's like, what are you doing? And I'm like standing there, and I'm like, Jordan, I think you need to go to Shoppers. And he's like, why? And I gave him the pregnancy test. He's like, oh no. I'm like, I know, right? Oh shit. I'm like, I was gonna fuck with you today. I'm like,
Oh
cause like I still had the marker in my hand, and he's just like, oh, Amie. So he bolts out, and he comes back with like one of the like clear blue ones that'll say like yes or no or whatever.
yeah.
Cause like at this point, I'm like, I don't want to, like, I really want to know. Um, so it's a positive test. I'm like, oh man, like, what are we gonna do? And he's like, nothing. We'll just wait it out, whatever the case may be. And I'm like, okay, like, should we tell anybody? And he's like, nah, let's just, go with the flow. So at that time, I think I went in for an ultrasound. I was 6 weeks, heart rate's there, everything was looking fine and whatever. So, of course, they don't see you regularly when you're that, like, I guess, far along. Sorry, I was way more than 6 weeks, because my period was all, my dates were all messed up. So they had me something at like 11 weeks. So they're like, oh, your next ultrasound, we'll wait for dating for your like first trimester, 13 weeks, 12 weeks. And I was like, okay. So I left there, and I started to bleed, and I was like, oh, okay, maybe it's just light spotting. I had something called a subchorionic with my daughter. So that is essentially when you have bleeding behind the placenta. And yes, it can threaten a miscarriage, and then or it could be reabsorbed. So I was like, with Emily, it was reabsorbed, so it wasn't a problem. But with this one, I just like the bleeding started kind of just really lightly. And then I called my OB because she was actually my friend. And I was like, hey, like, I'm bleeding. Like, is there any way I can kind of get in to see you? And she's like, oh, um, definitely come in. And then also, like, the other part is I've been having issues with my blood pressure since my daughter's pregnancy. So it never really came down after having the twins. I had something called preeclampsia. So essentially that's high blood pressure in pregnancy with them, and it never really readjusted itself. So I'm still kind of like, I guess I'd say it was untreated. Yes, nurses don't take care of themselves. And so she's like, you need to start taking ASA, and you need to start I'm gonna hook you up with internal medicine to get your blood pressure under control. And I was like, okay. So I think she got me an appointment for the clinic. I think it was like a week or a week and a half later, so I was now probably around 13 weeks. And she's like, first do an ultrasound, then come down to my office. And I was like, okay. So I got in, and they're like, okay, let's do this ultrasound. And now it's like COVID time, so now they're just not letting people up. So of course Jordan couldn't come in with me, so I go do the ultrasound. He's waiting in the car with the kids, and the ultrasound tech's just like, straight face. I'm like, okay. I'm like, because the first time I was there, they're like, oh yeah, everything's great, blah blah blah, here's heart rate. I'm like, okay. So she's just looking at me, and she's like, all right, so just go down to see your doctor. She'll give you your results. Boom. Right there, I was like, okay, I think I've lost this pregnancy. I was like, so does everything look okay? She's like, oh no, just go down, and your doctor will tell you. And I was like, okay, I know exactly what's happening here. So I get downstairs to see her, and if I can't say her name, but Sarah, this person's personality. She's so frantic, right?
I know exactly who she is. She's got no
She's
filter,
like
especially with
super
you.
frantic.
You guys have a
So I get
history,
down there,
so
and there's like a pregnant patient that was like out in the hallway that had fainted, and she's like, Amy, can you help? And I'm like, yeah, sure. She's like, the ambulance should be coming up. Like, I'm like, sure. I guess I'm like at work now. So I go
Oh
down.
no.
I tell you, right? So I go down. Um, the ambulance is like, where do we go? I'm like, oh, come up here to this office or whatever. So the ambulance comes and takes this other pregnant patient away to the hospital because she fainted in the doctor's office. So I was like, okay. And she's like, oh, just come straight into my office. And I'm like, okay. So I'm sitting there, and she comes in. She has this look on her face. She has the papers. I'm like, there's no heartbeat, right? And she's like, no. She's like, how did you know? I'm like, because I could tell, like, I could tell your face or whatever. And she's like, no, there's no heartbeat. Your blood pressures were too high. So like I was recording pressures at like 170 over 100. They were ridiculous. And I was kind of psyching myself up for the fact that, like, because it was so under, like, not under control, that this could be something that happens. So I left, and I actually felt like nothing. It was kind of bizarre. Like I was like, okay, fine. And she's like, are you okay? I'm like, yep, I'm good. I'm good. And I got down to the car, and Jordan's looking at me, and he's like, so. And I'm like, no, baby's dead. No heart rate. And he started to cry. And I was like, no, it's fine. I'm fine. Like, everything's okay. And she gave me the same prescription that you had, Jess, for misoprostol. But now I'm like 13 weeks along. So I was like, okay, like, shouldn't be that bad, whatever. She's like, it's going to be like a heavy period, and you're going to bleed a lot. I'm like, okay. So for whatever reason, just numb. Like, I felt nothing. Just absolutely nothing. And in my mind, I'm like, yep, it was going to happen because it's my blood pressure and whatever. And I'm not going to be affected by it or whatever.
Mm-hmm.
And
You were
so,
protecting yourself.
yeah, seriously. So I go to the pharmacy, and I guess I'm like, I don't want to go in. Jordan, can you go pick up the misoprostol for me? So he had gotten my Pregvit, and I think he was telling me the same pharmacist that gave him the Pregvit was like, oh, congratulations, whatever. It was the same pharmacist now giving the misoprostol. So note to you people who are out filling prescriptions for people who are potentially pregnant, don't tell them congratulations, because maybe in a week they're gonna lose their child. Like, just give them the fucking meds and don't say anything. You know what I mean? So now Jordan had to face the same person, and of course they looked mortified because it was like within 2 weeks or whatever of itself. So he gets the misoprostol, and I just said to him, I'm like, I just want to take it now. I just want this done. Like I just want I just want this out of my body. I want it over and done with. And he's like, okay, okay. And it's during the pandemic, so like I actually had called and told my mom, and I was like, I don't want anybody to know. I just want to deal with this. And she's like, do you want me to come up? I'm like, no. Like everything was locked down. Like there were no restaurants, nothing was open. It was like a friggin' ghost town. And I was just like, no, I'll do this on my own. It'll be fine. Bad, bad, bad decision. Okay, like worst decision ever. So I take the misoprostol, I think. So I waited till the next day, and it was a Saturday, and I take the misoprostol, and I'm like, I don't feel anything, whatever. And by this time, I'm trickling, but like nothing. It's just like, the brown kind of spotting. I know, way too much information, but it's just like,
Yeah,
it's
yeah.
not, there was no action, essentially. So I take this misoprostol, and I feel nothing. And I'm like, okay, well, I'll just putter around the house, keep myself busy. So I'm like, moving things around, just keeping
So,
things
Amy,
busy.
dumb question. Did you like swallow it or did you
Okay.
have to insert it? Because mine was
Yeah.
inserted.
So I had to insert 3 tabs. So that's the other
Okay.
thing. So I went up to my bathroom, and of course they're like, shove it up as far as it
Yeah.
can go, right? So I'm like, okay, I'm whatever. So I laid down, I took a couple deep breaths, and I just kind of shoved, like, I think it was like 3 pills, and I just shoved them up there, and I was like, they asked, oh yeah, they're like, lay down for half an hour. I was like, fuck this, I'm not laying down. I have shit to do. So I got
Amy.
up and moving around, and within like 3 hours, the pain hit me. Honest to God, it was like, they say it's like having a period. God, no. It was the worst friggin' pain I had in my entire life. So I'm like, I couldn't even friggin' move. So now I have
Did you get narcotics with it? Like, did you get some
no.
pain
You
meds?
think that OB would
You
give me
didn't get
some damn pain
T3s?
I
meds?
didn't get pain meds either.
No,
Well, I mean,
nothing.
right after.
Really? When I worked at the clinic, we used to prescribe Tylenol 3s, but this was like
I
10 years
got
ago, so maybe
nothing.
things have
Nothing,
changed.
Sarah. Nothing. Sarah
Were you
Jessica,
told to
zero.
were you told to keep things on hand, like just even like Tylenol or
I
Advil or
think,
anything?
okay, so this is an assumption. I think the OB had assumed that because I'm in practice, that I should know what to expect. And I think that
Right.
was an assumption, a poor one on her part, because like I didn't expect anything like this. So the ki- excuse me, the kids are running around. Jordan's trying to like wrangle them up, and I'm in like debilitating pain. And then all of a sudden I felt like a plop, and I was like, shit. So I go, and now I'm passing fucking crazy, crazy clots. And I couldn't even get myself off the toilet. So like I just had to sit in the bathroom by myself, because like Jordan, he kept on trying to come in and check on me, and I was just like, no, just fucking leave me alone. I got this. And then like the kids would come in, and they're like, mom, you're still in the bathroom, are you taking like a poop? I'm like, no, I'm not taking a poop. Mommy's having a bad day, like give me a break. And the I just
Oh.
couldn't get off the toilet. And I know they tell you not to look, but it's like hard not to look, and I probably shouldn't have looked. But I think um that was the moment for me. It became really real, and I was just like super sad. Just really, really sad. I was just
So
kind of like,
I,
oh, I was like, oh, well, I guess I cared more than I thought I cared, right? Like I was just
Mhm.
like, because I was
Yeah.
trying to be so brave, and I think that we have that persona where we've got to be strong all the time, and it was like a gut punch. Like I couldn't. There was nothing I could do to stop feeling the way I was feeling. I was just like, this is really overwhelming, and feeling that yes, I had all these people around, but feeling so alone.
and you were alone. I mean, right then,
Yeah,
you
and it
know.
was just like, and like just I think it was like coupled with the pain, and I guess trying to displace the emotion. It was just like it took a lot out of me. I was just like, yeah, I didn't expect to feel so overwhelmed, but it was just like I didn't expect
Mhm.
it. So I think just for and then I think just for me, I just needed someone to say to me that it's like it's okay. And I just at that point in time, I didn't really have anybody around to be like it's going to
Mhm.
be okay. Like I had to do it all on my own.
Yeah.
And you would think that the bleeding would stop like right after. No. So like 2 weeks later, I was wearing like, those jumbo overnight maxis, not the thin ones, the ones that are like a, a diaper, an
Like the
adult
old
diaper.
school
Like
one.
the ones that you wear after you have a
Yeah.
Yeah.
baby in the
So I'm wearing
hospital.
these like diaper pads
Yeah.
pretty much. And I'm just like,
Terrible.
this is the worst. And I felt that I couldn't tell anybody. And I felt that it was just like nobody would really care. Nobody would really understand. And I was kind of like, I should know better than this. But it's just a feeling that you have. Like I don't know how to explain it. It's just you have this feeling. You just want to bottle it up and you just don't want to tell anybody.
Yeah.
Yeah.
Yeah. So
Oh, that was
Well,
tough.
one thing it hurts too much to talk about.
yeah.
I think the thing of it is like once that happens to you and you do, find a voice or people find out, like me, obviously everyone at like my work knew I was pregnant and then they knew I lost the baby. Um, so people would come to me sometimes and say like, "Oh, I too lost a baby," or like they'd send me a card and they'd say, thinking of you, like this happened to me 20 years ago or something. So it happens much, much more than we think. It's just that everybody like doesn't want to talk about it.
Yeah. There's like this cone of
Yeah, I
silence.
think that's
Yeah.
yeah. Well, I mean, both of you, I haven't experienced the loss, but I think both of you have talked about how when you coped with it, you just felt so alone. And I feel like this is really common, you know? And I wish there was a way that we could just start having more conversations because it's like, it's obviously really common and people have experienced more than one. And I think there's a lot of things that can be triggering if you don't know that someone's had a
Absolutely.
loss.
I
Yeah.
have so many, I think, so many triggers. Like, yeah.
And I think the stats are 1 in 4, but I feel like it's more. I feel like there are miscarriages that people don't know about, or maybe they've had like they've missed their period and then they have a really
Hmm.
heavy period. It's just or people test really early because they have those early pregnancy tests now that you can take a week before or whatever, and then all of a
Yeah.
sudden you have your period. So again, you feel like shit. But
Hmm.
I think it is really about having the conversation and kind of trying to remove that cone of silence. It's like people don't want to offend, like I don't know if it's people, we don't want to offend other people, or you know just our own insecurities about talking about it. Or like I remember, and I'll make this really quick, like just talking about my first loss was I found out I was pregnant and I was like, yay, this is great. And my I think like I started having really bad pain and I pretty much like collapsed down. And I think my dad was home or whatever, and I was like, I can't move, you need to like call 911. So he calls 911. They take me in an ambulance, and they tell me that there's one in utero, one in my fallopian tube. I'm like, no, this can't be happening. And they're like, oh, the one in the uterus might be a pseudo pregnancy, don't worry about it, but we gotta, essentially you're gonna die if we don't get rid of this ectopic. So I can't remember where Jordan was, but he ended up showing up. And they're just like, so bad news. And I'm like, what? And they're like, we have to take your whole right tube. And I was like, I beg your pardon, like what do you have to do? And they're like, we have to remove the whole right tube. And I was just like, okay, so like I can barely get pregnant just in general. And now you're gonna take my fallopian tube. But like I had no choice, right? So I think with that particular loss for me, it was a shock, but it wasn't, I don't know, it was different than the second one.
Were you trying for this
Yeah, we were
pregnancy?
doing fertility. I actually had done an IUI wash or something. So essentially that's where they take, I guess, the fresh sperm, or well, I don't know how fresh it is. That's really weird. Anyways, so essentially they take the sperm and they like insert it into your uterus. Sorry, I can't. I'm drawing a blank. Anyways, inserted into your body closer to oh yeah, so they kind of like they like flush your tubes and they try to put the sperm up closer so you have an increased likelihood of getting pregnant. So we did that, found out, and then like it was ectopic, so that was tons of fun, but a completely different experience because of course I ended up waking up in the hospital, now missing a right tube and not having a baby. But for whatever reason, this last experience was much worse.
Mm-hmm.
But yeah, I think again, somehow we got to break that code of silence, and I think um, how do we do that? I think we do that by talking about it and sharing our stories and sharing our experiences with one another. And I think it's almost like we need to tell ourselves as women that it's okay. Like, it was a horrible thing that happened to you, but it's okay to talk about it. It's okay if you want to, you know, it's okay if you don't want to talk about it too, but like, I feel that most women, maybe I'm wrong, would be would feel encouraged if someone else told them that it's okay to talk about it.
Yeah, and maybe as women, we just don't want to burden other people with our problems, so we just keep it to ourselves. Where, like other people have gone through the same thing, and maybe if we did talk about it more, then we would get more support from each other. So I really think that it's important. I'm just wondering, Jessica and Amie, is there something that you would want to tell our listeners about your experience, like something that you would want someone to know that hasn't experienced this before? And maybe it's not just one thing, maybe there's a couple things, if you could think of
Hmm.
anything.
Something to know if they've not experienced it. Um, just that it's way more worse than you would think, if you've not experienced it. Um, it's the same when we lose a loved one or we lose a friend or we hear of somebody losing somebody, we're like, oh, that's sad. But when it's actually happening to you, it's much more painful. So I think just to have compassion for people, and like Amy said, and Sarah, you were talking about it earlier, like don't say to people, you're still young, or at least you have one, or at
Right.
least, um, you can try again. Like, I hated everything about everything that everyone said to me for probably the first at least 2 or 3 months after. Like, even if they thought they were being nice by saying something to me, like, it was the wrong thing that they were saying. And I just remember, like, hating the world, basically, and hating everyone. So if that is anything, I would want people to know that, like, it's more painful than you think, and like, don't say something ridiculous.
Right.
Yeah, like I think hmm, I mean, I completely agree with what you're saying, Jessica, in terms of those cliche awful things that people say. Like I think
Terrible. I've heard all of them. Oh my
that's
gosh.
the worst. I think if anything, like, why don't you bake me a friggin' cake or something? Like, don't say
Even
any
then,
stupid shit to me.
I'm
Just
gonna hate
give me
that cake.
food.
Even then, I'm gonna hate that cake because no matter what you say to me, like, just leave me alone.
Yeah.
I mean, honestly, guys, there was nothing. There was nothing. And I know, like, as a calm, rational human being, I know that, like, that mindset of mine was wrong, but that was what it was. Like, you could not say anything to me, and I was like totally taking it like the wrong way.
Right.
But people should, people have to recognize that that's okay because you're hormonal for one thing.
Yeah, your hormones are messed
Your
up.
hormones are like back to normal. So you're hormonal, you're grieving. It's just way too much.
I think the other
Hmm.
part might be also to remember that there might be two people who have skin in the game, right? Like
Absolutely.
um I think when it came to like my first loss, which even though it didn't impact me the same way as my second loss, I think it really affected Jordan a lot. And they pretty much never even looked at him. It was really bizarre. So they'd come in their room and they would talk to me and they would talk to me about the loss and they wouldn't say a word to him. And I think that was one of the things that he kind of pointed out to me, that, like, there are, yes, the woman's physically experiencing it, and not to take away from her experience, but just to remember I'm there too, right? Like,
Yeah, and
we
you
did create this
Yeah,
together,
that's true.
but I'm here
Yeah.
too. And when he said that to me, I almost thought about my own practice. It's like, how many times have I gone into a room where a woman was experiencing a loss and I didn't address their spouse or their partner or whoever was there with them, and it made me think, to be like, damn, maybe I didn't pay that attention to the other person as well. And I don't think it's that they want anything. I think it's just acknowledgement that they're going through it too. So I think if there's anything that I want people to take away too, is to understand that there are two people experiencing it, and not to forget about the other person. Because I think we as women deal with it a little bit differently than men, and I think they might not be as vocal about it, but it still affects them. So I remember Jordan being like like afterwards, kind of like a little short with me, and I was like, "What's your problem, dude? You didn't friggin' lose a baby." And I was like, "Oh, wait a minute, that like I'm being a friggin' asshole, because like, like we're in this together, right? Like I couldn't make a baby without you, so
Mhm.
Mhm.
you had just as much invested in it as me." And I think going back to kind of what you were saying, Jessica, too, but like there's nothing that really anybody can say, and just to understand that that person needs to take time. Because when I think about it, it's like, we I don't know, maybe this is just me, but like when I found out I was pregnant, whether it was with the twins or during my losses, you start to think and anticipate all the great things that this little being could be, right? Like, I remember being like, all right, we're gonna have maybe we're gonna have a boy or girl, doesn't matter. But like, you start anticipating all of the things that might be. And when it's like your world comes crashing down, when it's like you've lost the idea of what this person could be, if that makes any sense. I don't know. It's just kind of like
Mhm.
you
Absolutely.
you
It's funny
yeah.
that you said that because just earlier tonight, right before this, actually, I was scrolling through Facebook and I took a photo of a meme that somebody posted, and it says, "When you are pregnant, or either talking to your when you are pregnant, you are either talking to your baby constantly in your mind or thinking of things relating to your baby. That is why it is like falling through a trap door if they die. One moment you are in this avid dialogue, the next moment silence. I think it may be the loneliest feeling in the world," which is absolutely true. Because it is
Mhm.
your whole entire world. I mean, at least for me, it's my whole entire world when I got pregnant was nothing but that baby, you
Yeah.
know? And then the next one day later, it's like nothing.
Yeah.
Yeah. Oh, well, this has been a heavy topic, I think. Amy, Jessica, anything that you wanted to
I
add?
think maybe just one
I
more
think that
from Jessica.
Mhm.
So how do we move forward? Do we move forward? Like, what have you done? And this is maybe where your psychology might be able to help even
Mhm.
myself. Like, what do we do from here? How do we does it get better? Are there ways to make, not to make it go away, but to maybe remember or celebrate or do something different? Like, how do we move forward? How did you move forward? If you want to even call it that, like, or how do you
Right.
cope day to day? Maybe that would be better.
So I think everybody is definitely different, especially from, a counseling perspective. I see that, all my clients are different. One thing I like to tell everybody, no matter what kind of loss they've endured, your pain, someone else's pain does not negate your pain. So a lot of times I hear clients come in and they say, well, I lost a baby at 6 months old or whatever, but at least it's not as bad as losing a child that you've had for 5 years or something like that.
Right. Okay.
And so I'm always reminding everybody, just because somebody had something for 5 years or maybe experienced a loss that you perceive as more significant than your own, doesn't negate your pain, doesn't negate your loss. And we are allowed to grieve even if we had a 6 week pregnancy, even if we had an 18-week pregnancy. That doesn't mean any less than someone else experiencing their loss.
Right.
But I think we try to justify things like, well, we should hold it together because that person, lost a full term baby, or that person, lost a 3-year old. Like, then we think we don't have a right to grieve or a right to feel
Mm-hmm.
sad. So I've had to teach myself that, because I was one of those people that was like, well, at least that I was only 18 weeks and I wasn't, 40 weeks.
Right.
Um, so that kind of, getting that in your mind, like it's okay to be sad and you deserve it. And it was painful, like no matter what. The other thing I feel like is talking about it. So maybe that's not talking to the whole world about it. Maybe that's, seeking a counselor, or going to a support group, or, talking to somebody at your church, or like one of your friends, getting involved somehow in something bigger than yourself. A lot of times can help people.
Right.
So something I did that I never thought I could do was I actually volunteered at a pregnancy life center.
Oh, wow, I didn't
And
know that.
it was
Oh,
like literally
wow.
like a month after I lost the baby. And I was like, this
Wow.
is never going to happen, And I ended up volunteering there for like 3 or 4 years. Um, and it was just something bigger than me. The purpose was bigger than me. It gave me a little bit of something else to do with my time than just sit and wallow in my self pity.
Right. Yeah.
Uh, I was helping others. Um, but then, I think the biggest part of my healing came when my niece um, lost a full term baby at 40 weeks
Right. I
from a
remember.
uterine rupture. And that girl never stayed silent. She never stayed silent from the day it happened. She was constantly talking about it. And I was like, whoa, this is so taboo. But at the same time, something about that healed me. Like, she was so brave and so strong and so, like, every day talking about him, that it was like, you know what? I can talk about my baby too. Like, this is okay, and we can do this. Like, if we're together and we're like a solid team.
Right.
So some of that really actually was profound for me.
Yeah, those are really amazing things. Like, I mean, I take my hat off to you. I didn't even know that after your loss that you went out and volunteered your services and, like, went out and helped other women. That's amazing. Like, I don't even know what to say. Like,
Mm-hmm.
I kind of took a page from you guys, and I never really told anybody about it, but, when I was working at undisclosed organization, I started talking about, getting cuddle cots because it was out of a newspaper article that I believe Lenny had clipped from you guys and your niece about, investing in, these cuddle cots, so parents and families can spend more time with their babies that have passed on, and I think those things are amazing. So out of someone else's pain, will bring, someone an extra opportunity to hold their baby a little bit longer, and I think,
Absolutely.
I was trying to get that at our organization. I don't know if they did, but I know it was
Mhm.
definitely something we were looking at, from a funding perspective, and it was definitely on our, I don't wanna say our scorecard, but on our list of things to do, so, and I'm sure other people saw
Mm-hmm.
that and was saying, "Hey, I think this is something that our organization needs as well," but,
My niece has raised
Mm-hmm.
money for us, quite a few of those around here. Actually, the one at the hospital right across from where I live now actually has my baby's name on it because she donated it in his memory um, to the local hospital here in our town. So she's done remarkable things with her loss, and and raising awareness in our local communities around here.
that's amazing.
Hmm.
My hat goes off to both of you
Mm-hmm.
ladies.
That's so
I think
inspirational.
women like, and I'm not, trust me, I'm not a feminist. Well, maybe I kind of am, but I think women are so much stronger than we know that we are. Like, I feel like we are kind of like, I don't know, I'm trying to think of the right word, but it's just like I don't know. I think we are just such powerful beings, and I think that we don't nearly get enough credit for the shit that we go through, that we deal with
Yeah,
on a day-to-day.
absolutely. And I
Mhm.
think when we band together,
Yeah,
talk to each other, band together, do things together, we're the ones that get shit done, you know?
seriously.
So
Exactly.
we're
Yeah.
not waiting for
Yeah.
nobody. Like, we are just doing it.
Right. And Jessica and Amy, I'm so proud of you both for sharing your stories today, because I think that this was probably not an easy thing, and it was very emotional for you, and it brought up a lot of memories. But I think it's really important for our listeners to hear your stories. And I'm so glad that you were able to share your stories with us today. And one thing that I've taken from my experience working with women is just to be really sensitive about when people have been married for a certain amount of time and maybe they don't have children,
Yeah.
not asking, especially like in big social gatherings, like, oh, so why don't you have kids yet? You don't know what
Yeah,
they've been going through. Maybe they've had three losses
absolutely.
already and they don't want to share that with the whole world. But just, I guess, sort of being more sensitive and not making assumptions when you don't know the whole story.
Right.
Right, no, I
So
agree.
Hmm.
And for people to stop asking the question because it's not their damn uterus. Like, I
oh
mean,
my gosh, I have been asked so
Exactly.
many
it's
times,
Exactly.
like,
when
"Don't
am I
ask
having
me."
kids? How
Right.
many kids am I having? Even from family members.
Yeah, no, I
And
think it's
that's
fair.
really tough because I'm like, shut up. Like if you want to put me on bed rest and knock my ass out for 10 months, like, okay, that's fine, but you better have a lot of drugs handy because I cannot be coherent for these 40 weeks. Like, I can't.
Seriously, right?
Okay.
Like,
And it's
honestly, I'm like, that's the only way a kid is coming, like, here.
yeah.
Like,
Right. Right.
so yeah.
Okay.
It's like you're
Yeah.
gonna pay, and I'm not
Okay.
gonna be coherent through this whole damn
Yeah.
thing.
Exactly.
Well, I mean, I don't really have much more
Uh,
to add, but I would like to say thank you so much, Jessica, for sharing your story. I can't believe this is the first time I'm hearing it, but I really, really appreciate it. I think I've always had respect for you, but I feel like I have an even more renewed respect for you and appreciation for what you've gone through. And I mean, I think you're an amazing, amazing, strong, beautiful woman.
I
Oh,
see
thank
your
you.
cute little self all the time on my Facebook. So
and if I could give you guys both virtual hugs right now, I would. Even though, Jessica, I've never met you, I'm giving you a virtual hug, and you, Amy, too.
It's okay to cry as long as you let him go. It wasn't your fault. You didn't know. Pathological lies I rarely found out. You're one of the lucky ones, though you can't see it now. It's okay to heal. Take the time that you need. Yeah, I know that you're stronger than what you believe. This is the last time he'll leave you this hurt. You can move on. Life lesson learned. Don't go looking for love where you lost it. You deserve better. It'll get better, I promise. I promise. You didn't do anything wrong. Don't know what he was doing, but it wasn't love. All I know is it's insanity, doing this all again just to differently. Don't go looking for love where you lost it. You deserve better. It'll get better, I promise. I promise. Give yourself some grace. Deep breath, you're gonna be okay. You are finally safe. Deep breath, you're gonna be okay.